Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Don't forget to subscribe so you don't miss any future episodes. You can really help the show reach more loss and infertility families by taking a moment to leave a positive review or rating on Apple or Spotify. Also, check us out on Patreon for exclusive bonus content. Just go to patreon.com/Finding Hope After Loss. You can also check out more information about the episode in the show notes at journeyforjasmine.com. In this episode, Elle shares her journey through infertility, PCOS, and a triplet pregnancy after fertility treatment. She talks about the heartbreaking neonatal loss of all three of her children due to pregnancy complications, premature birth, and NICU struggles. Hello, everyone. Today I am here with Elle. Elle, can you tell us a little about yourself?
Hello, thank you so much for having me. So yeah, Sarah so lovingly says, my name is Elle. I am a baby loss, pregnancy and parenting after loss therapist. I work with lost mums across the world, which I'm so grateful that I get to do, but I also, in a way, hate that I have to do this job in the first place. But I'm just grateful that I get to create a safe space for people. And I have helped women all over the world through their grief and to move forward in life after losing their child or children, to lean into hope and allow joy and grief to coexist.
Do you know what the furthest away someone has been from you, client-wise, that you've seen?
Ooh, that's a good question. I've had probably Australia would be the furthest. I've had a couple of clients down in Oz and in the Far East. But yeah, I have a lot of American clients, which I love.
So do you mind sharing a little more about what led you to that and your lost journey?
Yeah, absolutely. So I very much fell into what I do, and I will take you right back to the beginning. So in 2021, in January, I found out that I was pregnant. And my partner and I, Lewis, we had been trying to conceive for a couple of years, and I have PCOS that was pretty severe and pretty unchecked at the time. So I wasn't ovulating for the longest time. And we saw a gynecologist or an OBGYN, whatever you want to call them, and they basically got us set up with some medication. So the first cycle that we were on letrozole, we got pregnant, and we were so grateful and so lucky. And I remember taking the test and just being completely awestruck because I'd taken so many pregnancy tests and I'd never seen a positive one until that point. And you know what it's like when you're checking them in the light constantly. And that first positive, just I was like, wow, this is it. We're going to be parents. And in that moment, you have so much naivety. You just think, well, this is it now. I'm going to bring a baby home. It's done. You don't kind of understand that things can go wrong, or you hear of it, but you never think it's going to happen to you. And ironically, I was around 7 or 8 weeks pregnant, and my mum came over and she was like, "You're showing already." She was like, "That's not normal this early." So I was like, "Okay." So I booked a private scan because over here in the NHS, we don't have our first scan till around 12 weeks. And I went for a private scan, and as soon as they put the Doppler on, I saw two straight away. So we were like, "Oh my God, it's going to be twins." My fiance Lewis is a twin anyway, so he was jumping for joy, thinking that he'd carried on the gene. And the tech went really quiet, and then I was thinking, oh shoot, there's something wrong. And she looked at me and she was like, "It's okay, Mom, there's nothing wrong. I'm just going to go grab the other tech." So my heart was in my throat already, thinking something's wrong. And the other tech came in and she just looked at me and beamed, and she was like, "Yep, I see it too." And I was like, What are you seeing?" And she was like, "There's a third baby." And I was just like, holy crap. What do I do with three? And me and Lewis just looked at each other and were like, two, we can get our heads around, but three? What do we do with three? And she was just like, "I'm just going to check to make sure there is only one baby in each sack." And I was thinking, please, Lord, don't make me carry a litter. I don't know if I can deal with six. So she checked and she was like, "No, there's definitely three." It was the best situation for a triplet pregnancy. So it was trichorionic, triamniotic. So they all had their own amniotic sacs and placentas. So it was technically three separate pregnancies just at the same time. And that was kind of the start of our journey. We left and we were just completely awestruck for like 2 weeks. It took us time to get our heads around it. But at that point, again, that naivety, we were like, okay, we're like instant family. We have three kids straight away. Like we're done. We're one and done. And I always pictured myself having 2 kids, and I kind of thought I'd stop at that. And then I got my head around having 3, and I was like, okay, this is great. And my pregnancy was pretty smooth sailing. I was really fortunate that I was one of those mums that can sit there and say, I had nausea, but I didn't get morning sickness. I didn't really have any other ailments. I had a pretty great pregnancy. And then it got to when I was about 15 or so weeks, and I noticed that I thought I was starting to leak fluid. And I raised it with my doctors, and they were like, no, you're fine, you're having triplets, it's usual to have more stuff going on. So me just trusting my medical team was like, okay, whatever. And then I reached at about 20 weeks, and something just felt off, and the amount of fluid I was losing was seemed to be getting heavier, to the point that, like, I was having to wear liners. If I didn't, I was just changing my underwear multiple times a day. I know that's major TMI, but I thought, this isn't right. I'd raised it another couple of times, and again they dismissed me. And it got to, there was one particular day, and I noticed that something felt off, and I felt like I was starting to get signs of an infection. So I got in touch with my medical team. I was like, hey, I think this is going on. I'm not sure. I didn't hear back off them, so I just kind of left it. I was like, if it's anything major, they would have got back to me and let me know. So I'm assuming it's fine. And it kind of just carried on the same for like 6, 7 days. And then I remember feeling really sick on the Sunday. So I said to Lucy, like, I'm just going to go to bed. I feel crappy. I'm just going to sleep it off. And when I woke up on the Monday, my mom came over and she looked at me. She's like, you look like hell. You need to go to the hospital. So I was just like, okay, thinking she's just been an overreacting mum. And I was like, oh, I think I'm fine. I don't think there's anything wrong. I was just feeling a bit weird, had a bit of pain under my chest and couldn't really explain it. So I thought, okay, I'll go. They were still moving, everything felt fine. And I got there, and just the sheer look of panic on their faces, I knew straight away that something wasn't okay. They rushed me into a side room, into a bed. I had an ECG on. They were getting an IV set up. I had about 6 people around my bed, and I was like, okay, something's not okay here. And I just felt so, it was mid COVID, so I wasn't allowed anybody with me either, so I was on my own. And I felt so out of my depth, and I just didn't know what was going on. And naively, I just thought, oh, it's fine, they'll fix it, and I'll be on my way in a couple of hours. That's when a consultant came in, and she said to me, we're not sure what's happening, but we think that you might have sepsis. So we need to get this checked quickly. So they started giving me IV antibiotics and fluids and all that stuff. And again, I was still thinking, oh, a couple of days and I'll be home, I'll be good. The baby seemed okay, and everything seemed to be getting under control until the next day. They told me in the afternoon that I'd probably be able to go home the next morning because all my infection markers had come down. And I sent my partner home, sent my parents away. I was like, it's fine, I'll be good. They had literally just got home, and it was like 5 p.m. I'd just eaten dinner. I stood up and my waters broke. And that was kind of the point of no return for me. I was like, okay, this isn't going to get better. And I called for a midwife, and it was the first and only time I've ever had a male midwife, but he was the best midwife ever. He was the nicest person, the best person I could have asked for in that moment. He took my hands and he was like, listen, this doesn't mean the end. I've seen this happen to a lot of women. Your waters can replenish. We'll keep you in. You're going to be okay. It might have been a little bit of fluff, but it was what I needed in that moment just to keep my head. So they came down, they grabbed me, they rushed me up to the delivery suite, they gave me steroid shots, they put me on a magnesium drip, which was horrendous. And I was just like, okay, what's the situation? What's going to happen? And we were like, we don't know. We're just going to keep you in here. We're going to monitor you. And the next morning, they came round and they did an ultrasound, and the doctor that did it said that because they were all sitting like an upside down triangle, no, sorry, like a triangle, because I had Noah on the bottom and then I had Eden on one side and Hudson on the other. So it's like a normal triangle. And they said that it was Noah's waters that had broken, and they couldn't do an internal exam because there was just so much infection present they couldn't see anything. And they told me they couldn't pick up his heartbeat with the scan. So they told me that he was going to be stillborn. So I mentally prepared myself for a stillborn. They were like, he's already in your birth canal, you're already dilating, he's going to be here soon. So I prepared myself for that grief. And I kept saying to my mom and to the midwife, I was like, I can feel him moving. And they were like, no, no, it'll just be your body trying to push him out. And I knew that something wasn't right. I knew that what they were telling me wasn't true. Just that instinct of like, no, he's alive. I know he's not dead. And I did what they told me to do. I just carried on. For some reason, my body was dilating, but I wasn't having contractions that I could feel, which I'm grateful for now. But at the time, I was like, I don't even know if I'm in labour. It wasn't until I just felt a pressure and I was like, okay, well, I think he's ready to come out. So I gave birth to him. The midwife rushed him away, and she just had this look of fear in her eyes. And she was like, I'm so sorry, you were right. He's showing signs of life. What do you want to do? So I was like, get the doctors in, get the crash teams in. He was 23 and 2. So at that hospital, they would take babies from 22 weeks. So I was like, get them in, save him, get into the NICU. And she just looked at me with such sorrow in her eyes, and she was like, I'm so sorry, we can't, because of what the process we've gone through. We thought he was going to be stillborn, and you decided to opt for palliative care because of that. We can't go back on that decision. We don't have the teams or the crash carts to do anything, and by the time we could, it would be too late. So I was so angry at that point and felt so let down and so sad that I literally had no choice but to watch my baby die. They wouldn't give me another option. That it kind of felt like it robbed that moment for me. So we had about 3 or 4 hours with Noah, and I was really lucky that I had my parents there. We all spent time with him. Just did what you have to do when you know you're not gonna have that much time with your baby. We sang to him, we took plenty of pictures and videos, we read to him, dressed him, all that kind of stuff. And that was my first experience of handing a baby to a nurse and knowing that I wasn't going to see them again. And in my mind, I was like, okay, I've done it once. I need to put my focus into my 2 babies that are still in there, they're still cooking, they're still here. I need to make sure they get through. And I remember the doctor coming into me and saying to me, I know it's really hard, but you need to put your grief aside because you need to be strong for your 2 other babies. And I was like, how can you ask that of me? So I felt like I didn't really get a chance to process Noah's death properly because I was so having to put a pin in it, like, okay, let's just move forward, let's just do what we've got to do. And I did, and my labour stopped. And I remember a doctor coming in because they didn't know what to do with me at that point because it was not a case they'd ever had before. So they sutured my umbilical cord, they stitched the bottom of it up where they'd cut it, and they put it back inside my cervix and left the placenta in because they were worried that if they took the placenta out, it would pull the other 2 out as well. But they knew that this infection was heavily present in this placenta and it could cause other issues. So they just had to take a gamble on what to do. Because I'm not sure it's because of that or because I was already struggling with I had choriamnitis and sepsis, and I just wasn't getting any better. I was still super sick. But I remember the doctor that stitched the umbilical cord looked at me and he said, I don't want to say this to upset you, but these other babies are probably going to come in the next 48 hours. And at that point, I thought, what a horrible person you are. Like, why would you say that to me? But now I appreciate the fact that he was the only person that was truly honest with me. But that was on the Wednesday, and my labour stopped after I gave birth to Noah. And I thought, okay, I'm just going to try and get through this. I'm going to stay in bed. I am not going to move. And I'll just stay here for as long as I need to till I get better, till this infection's gone, until they can come. And it's a safe time for them to come. And I remember it got to Friday, and I just sent Lewis home, and my mum took over to stay with me that night. And it got to about 10 or 11 p.m., and I started feeling twinges again. I just thought, oh no, please don't be this again. And I tried to go to sleep. I tried to ignore it and pretend it wasn't happening, and they just got worse and worse. And I was like, okay, I think I'm in labour. So I called my midwife in and I was like, can we figure out? So she strapped a CTG on and she was like, yeah, you're in labour. She was like, we can't stop it. We can't give you medication to stop it because you've already had one baby. It's not safe. So we're just going to have to leave you there and just pray that it's just false labour and it'll stop on its own. Unfortunately, it didn't. And I was in labour from 10 or 11 p.m. on the Friday night until 6 a.m. on the Sunday morning. So laboured all Friday night, all through Saturday, and into Sunday morning. And the consultant came in, a different consultant, and she said to me, look, what do you want to do? because we're at a crossroads here. You're 10 centimetres dilated. These babies are going to come. You can either give birth them naturally, but that's a greater risk for them, or you can have a C-section, which is a greater risk for you, but they have a better chance. And at that point, I was so exhausted, mentally, physically, emotionally. I was like, I don't have it in me to push, even if I wanted to. So I was just like, just give me a section, get them out. And they were like, okay, but we're going to have to put you under general because the medication that you've already been on. They didn't know if they had to cut me vertically. They didn't know if they would have to perform a hysterectomy, depending on the condition of my uterus. So I went into that surgery not knowing if I was going to make it out, not knowing if my kids were going to make it out, not knowing if I was going to make it out with or without a uterus, if I was ever going to be able to give birth naturally again. All of these questions. And I remember waving off to my family because, again, I couldn't have anybody with me having a general anaesthetic section. And I just grabbed the doctor's hand and I was like, please don't let me die. And she just looked at me and she was like, I'll try my best. And that's all I remember. I remember them wheeling me around, taking me off any gas, any medication, and just having back-to-back contractions in so much pain. The infection was making the contractions worse. And just thinking, I mean, I'm not a religious person, but I just thought, please, God, just let this be over. Whatever the outcome is, just let it end. And I don't remember anything after that until I woke up in the side room. And again, I was on my own. And the irony of it, you can't make these things up. I had a family next to me that had just had their baby, and the mum was there with her baby. The baby's crying, and I'm just lying there thinking, you've got to be joking. Like, I literally don't even know if my kids were alive or dead. And a nurse rushed in and she looked horrified that this was going on. She was like, I'm so sorry, I'll get you back to your room straight away. And I was like, well, thank you. It's about time. So they took me back round, but I said to her before she took me to my room, I was like, please, please, like, I just need to know, are they alive? And she was like, they're alive, they're okay, they're in the NICU. And I just burst into tears at that point. I was just the relief of knowing that they were alive. And I asked her to take me around to the NICU, and she was like, oh, you're really weak, you need to rest. And I was like, no, I need to see my kids. So she took me around, and I'm so grateful for that experience, but I feel so sorry for the doctors in there because I was fighting sleep like nobody's business. I must have literally been like this, dozing at every chance. But they were explaining it to me, and I just remember seeing these two tiny little things in these little boxes and just being like, wow, that's my kids. They're little human beings that have come out of me, and that they were perfectly formed. They were just tiny. So both the boys, Noah and Hudson, they were £1 and Eden was £1 They were good weights for triplets, and certainly triplets of that gestation. They were more similar to singletons of that gestation. So I was so pleased, and they seemed to be doing really well. And I thought, okay, this is it. I need to, again, my grief has got to be subsided, and I've just got to keep pushing forward. So I did, and the following few weeks were just simultaneously some of the best and worst weeks of my life. The constant cycle that I think any NICU parent can relate to, of just the constant up and down of, one day Eden would do well and Hudson wouldn't be so great, and the next day they'd switch, and it was just constant battles. And they were both born with grade 3 intraventricular brain hemorrhages, which is quite common for preemies of that gestation. They were both born with infections that they had caught from me. They both had multiple things going on, but they pushed through and they seemed to be dealing with it really well. But we got to day 8, and the NICU consultant, pulled me to the side, and she just said, it's about Hudson and it's not good. And I was like, please, I can't go through this again. And she just says, I'm so sorry. He has the worst neonatal infection I've ever seen, and I've been in this job for 20 plus years. I've thrown everything I possibly can at it, every antibiotic that we have, and nothing is touching it. They also thought that he may have had meningitis, and the brain bleed in his brain they hadn't been able to stem it, and it had started to seep out of the ventricles, the little pockets in the brain, into the brain tissue. And she said the only way that we can relieve that is if we drill through his skull every day to relieve the pressure and drain some of the fluid. So she was like, it's up to you what you want to do from here, but we basically can't do anything else for him other than that at this point. So I was like, okay, I had to put my head brain on instead of my heart brain on and think, okay, what do I do here? Because my mom brain is saying, he's my baby, I want to keep him here at every chance. But the logical part of me was thinking, I don't want him to suffer any more than he already has. And in order to keep him alive, we would have to relieve that pressure off his brain every day. And I just didn't think that was fair. So we said to her, what time frame are we working with? And she was like, I can keep him here as long as you want to, but he's never going to leave here. So I was like, okay, I can't. For me, and again, I would never judge anybody's decisions. I think you make what's right for you and your family. But for us, it was very much like I would rather rip off the band-aid and stop him from being in constant pain, because they're so tiny, nobody can tell you if they're in pain or not. They were giving them morphine and things, don't get me wrong, but at the same point, I just thought, I don't know what quality of life my baby has at this point, and I don't know how much longer he's going to continue to be able to fight it. And I kind of selfishly wanted it to be on our terms and for it to feel like it was the right time for us, and not for it to be like, how can I put it? Not for it to be like him literally going when he's utterly exhausted everything. So we made the decision at that point to take him off the life support. So we were taken around to a private room with him. And I remember they took everything off and we just had the morphine drip left on. And he was so, so sick. We only had about 20 minutes with him before he passed. And again, we did everything we could in those 20 minutes because we knew that we didn't have long with him. So we just spent time as a family as much as we could, dressed him, sang to him, rocked him, read to him, everything that we could cram into that really short space of time. And again, I remember thinking, I'm here again. I've literally got to hand my baby to a nurse knowing that I'm not going to see him again. And I just thought, how cruel could the world be to expect someone to go through this back to back? And we did, and I still to this day don't know how I did it. I will never get over the strength of lost parents in that moment. But we did what we have to do, and we thought, okay, well, we still have Eden, we still have to stay strong, we still have to pour everything we can, because we still have the chance of taking the child home. So we did. We threw ourselves into doing everything that we possibly could. They weren't even feeding, but I threw myself into expressing breast milk because it was the only thing that I had control over. So I didn't leave her side, just constantly expressed. And I remember one of the earliest triggers for me, before I'd even started processing my grief, was a couple of days after we lost Hudson. They always had their incubators next to each other. But I remember that day, it was 2 days after, I walked back into the NICU and they got another baby in the bay next to Eden. And I just remember thinking, I was like, no, this is wrong. You can't be there. That's Hudson's space. But that was the first real experience I had with the world keeps turning, even if yours doesn't. And that was so surreal. But yeah, I remember we poured everything into it that we possibly could. And it got to day 12, and we'd noticed for a couple of days that her tummy seemed like it was going a bit of a weird colour. Even though she seemed to be doing really well, she'd opened her eyes, she was responding to voices and noises, she was becoming a proper little person. She was almost 2 weeks old, and she was so feisty. And they sent for an ultrasound of her abdomen, and the hospital we were at was a teaching hospital, and the sonographer came around with a student. And I remember sitting there next to her bedside, and the sonographer said to the student, "Can you see anything that shouldn't be there?" And the student went, "Well, yeah, the bowel area is really bright and it shouldn't be." And the sonographer's like, "Yeah, you're right." So I was like, "Well, hold on, what do you mean it shouldn't be? What's going on?" And she looked at me and she said, "I'm so sorry, I can't tell you. I have to send the results off to the lab." And I just I lost my call. I was like, you can't do this to me. That's not fair. I've lost 2 kids at this point. If there's something wrong, I need to know. So I called my consultant over and I was like, I was frantic at this point. I was like, please do something. She went off, she came back and she was like, I don't know what's going on. I'll get the results as soon as I can. I don't think it's great news, but we'll let you know. And at this point, we'd already had a scare with Eden a couple of days after we lost Hudson. Her heart had stopped, and we'd had a call in the middle of the night. And we'd rushed over there, and they'd managed to get her back, but we didn't know how long she'd been without oxygen, if she got any further brain damage, and all this kind of stuff. So we'd already had one scare. But me and Lewis had said to each other, whatever happens, if we get to take her home, we'll take her home. And it got to day 13, and we got that call again. They were like, you need to come in. So we went in, and the consultant took us off into the side room again. I just thought, I know exactly how this is going to go. And she was already in tears, and she was just like, I'm so sorry. She was like, she has necrotizing enterocolitis, and there's nothing we can do. She was like, it's taken everything. And me being me, I was like, well, can we fly her to a children's hospital? Can she have surgery? Can she have a stoma? Like, we will deal with whatever we have to deal with. And she just said it's taken everything from her stomach to her rectum, and there is nothing in between to save. Even if we could get her to a children's hospital, we think that she won't make the journey because she's too fragile, and if they get her there, there's nothing for them to save even if they do operate. And she was like, you cannot survive something like this, and there's nothing else we can do. So again, I said, okay, well, what are our options? What do we do? How long have we got? And she just said, again, it's up to you how long you have, but she's not going to leave this hospital without being on life support, and we don't know how long she'll have on it. So again, at this point, and I know most lost parents will understand this when I say it, that for other people, it sounds so insensitive, but at that point, I just wanted it to be over. It had been over 2 weeks of just constant up and downs and struggles. So we were like, okay, if we're going to do it, we'll just do it now. So we took her off again. We took her out of that private room. But she was not ready to go. Like, she was definitely my feisty one, and she hung on for about 7 hours. She wasn't on a ventilator, CPAP, anything. She was breathing on her own for 7 or 8 hours. She was really, really, she wanted to be here. And, sorry.
Okay.
It always gets me this bit.
Ugh, I'm crying over here too. So.
I think it was that realization in that moment that everything we'd been through, we'd fought so hard for, that we were going home with that baby. And I remember we had that time with her again. We did the same as we did for her brothers. We bathed her, we changed her, we sang to her, rocked her, read to her, everything we could. And I remember in that moment I said to my partner, my parents, it's the first time where I'd actually felt like a parent, because I'd actually had some length of time with her. And it was so surreal, feeling like a parent, but equally feeling like your parenthood was being ripped away from you. We waited, and I noticed again they'd sent her in on her morphine drip. Because I had time to notice, and I noticed there was a little label on it that said that she was on 3 times the max dosage. And I thought, okay, well, at least that's helping with her pain, but I later learned that they do that with neonates to help them pass quicker, which is both a blessing and a curse, because you want them to be out of pain quicker, but you also want every moment that you can have with them. And I'll never ever forget any of these moments, but particularly that the doctor kept coming in to check her heartbeat. And I could feel that she was starting to go, she was starting to slip away. I could feel, her temperature was changing, her colour was changing. And I said to my mum and dad, I was like, I think it's time. And they called the doctor back in, and she checked, and she was like, yeah, I think she's gone. And just, I think every emotion hit me in that moment. I was just floored with everything, every feeling of all of that grief, that pent up grief that I'd hidden for so many weeks from my other babies just hit me like a brick wall. But also that simultaneous relief that this period of our life was over and that we could start to grieve. And then also the complete and utter heartbreak of having to leave the hospital without a baby. And I remember handing her to the nurse and saying, please take care of her. And she was her NICU nurse that had looked after her for the last few weeks, and she was in tears. And she said, I won't leave her till they come for her. And the only semblance of relief I had was knowing that they were going to be together and they weren't alone. And I remember leaving that room, and I don't know how I stayed upright to leave that hospital. And I walked out that day on the 13th day with 3 boxes instead of 3 babies. And I have never stepped foot back in that hospital since. And I don't think I could. And that was the start of the long road to where I am now. And I think, for the most part, a lot of people look at me and think, "Oh, well, you're a therapist, you should have it all together by now." And I'm like, "Yeah, but I'm still a human being." And telling this story still, it gets me every time. And I think I'm so used to telling my story, but telling it in its entirety and all the detail, it hits me every time just how much we had to go through. And yeah, I remember I was about 3 or 4 weeks postpartum, and I thought I was doing okay. And my mum said to me, she was like, I don't think you're okay. She was like, I think you need to see someone. And I don't think I realised how bad it had gotten, but I realised that I was just trying to do everything as a way to try and numb the pain. So I'm always one of those people anyway that takes care of everybody else and tries to sort everything. But I was just doing it in overdrive just as a way to try and distract myself. Yeah, she was like, "You need to get some help." So I was like, "Okay." So I reluctantly went for my mum, but the help we get over here from the NHS isn't great. Mental health support isn't fantastic. They're very stretched, but it was like a 4 month wait for any help, and the same for many charities. So I went to my doctor. Our PCPs, we call GPs. So I went to my GP and he was like, you can see the counsellor, that's the practice counsellor, but it was an older guy. And I said, in the nicest way possible, I'm sure he has the best intentions, but unless he's given birth and had to watch that baby die, he's not going to understand what I've been through. So I went on the hunt to try and find somebody, and I couldn't find anybody. But my aunt had a friend who was a therapist, and she hadn't lost a baby, but she had lost her husband really young. So I thought, okay, so she doesn't fully understand what I've been through, but she understands unexpected grief. So I went to see her, and I didn't expect much. But I left after the first session feeling like I had such a weight lifted off my shoulders, and it was the first time that I thought, okay, maybe this is going to change. It is going to get a bit not easier, but easier to carry. And I already had a background in mental health at that point. And she said to me a couple of sessions later when I went back, she was like, "Why don't you do this?" She was like, "You'd be so good. There's nobody out there that is helping women that have been through what you've been through. So why don't you do it?" And I went away, and that kind of planted the seed for me. And I was like, is this something that I want to do? Do I venture into this? But I'm very much like a dog with a bone when I get my teeth into something, and I couldn't get the seed out of my head. So I went away and figured out what I needed to do postgrad wise to qualify. So I did, and I went and got my qualification, and I've never looked back. I went back to my office job, ironically, after I qualified, because we get maternity leave here is 9 months, and I qualified for maternity leave because they had lived, which I was really grateful for. So I took the time off that I needed. And I remember going back to my office job just in case, thinking it's stability, and I felt like such a square peg in a round hole, and nobody understood me, nobody asked about them. It was kind of like they just thought they just disappeared. And I thought, I can't do this anymore. I'm not the same person that I was when I walked out of this office. So yeah, I quit and went full time in my practice, and I've never looked back. So that's my story.
Oh, yeah, you've just been through so much. And yeah, I think,
Yeah,
an important thing that you said about having to put some of your grief on hold because you had to put your grief on hold from the first to be, quote, strong for the other two. Then you had to put your grief on hold again with the second loss to be
yeah,
strong for the living baby. And then,
yeah,
I mean, it's just,
yeah. It's a lot.
it is.
It was a tough journey. It's not something I would ever wish on anybody, and I know that you cannot compare grief at all, and I never would want to. But yeah, we went through some stuff.
Did you know anybody else who had gone through anything like this before you went through it?
No, I was like most people. I'd heard of, the odd friend of a friend who'd had a miscarriage, but I'd never heard of anybody experiencing stillbirth or neonatal death or late term loss. I had a couple of friends that had had early miscarriages, and one of the first things I did after my loss when I spoke to them was apologise. Because it was the first time that I truly understood what they'd gone through, and I was just like, I am so sorry that I wasn't a better friend to you. I just didn't know. And that was when I started to do my research and found the lost community through Instagram, because there wasn't really anybody that I could talk about it with. I didn't know anybody that had been through this, because I think it is such a hush hush topic that people feel like they can't talk about it. So yeah.
When you were first pregnant with the triplets, did they diagnose you as like a high risk pregnancy at all or anything, like extra monitoring or anything like that?
Yeah, so we had an early appointment with a consultant at 10 weeks, and that appointment frightened the life out of me because he basically told me the chances of their survival were really slim. They actually encouraged us to go for selective reduction, which is an awful process to even think of. And again, I would never judge anybody for making a decision. You do what's right for your family, but it's a process where you go and terminate one or multiple of the pregnancies to give the remaining babies a better chance. And my decision would probably be different now, knowing what we've been through. But at the time, I was very much like, no, it's all or nothing. They all make it, or none of them make it. We'll take our chances. Again, being young, being naive, thinking it's just statistics. I'm not going to be that statistic. I'd found a community of multiple parents online that were all telling me like how great their pregnancies were and that their triplets had made it and they were okay, and I just naively lent into that and thought, no, my babies are going to be fine. But yes, they did give us plenty of extra monitoring, so I had appointments every 2 to 3 weeks, and I had extra scans and everything as well, and in between that time I had private scans because I was anxious anyway. So yeah, we did have extra care, but it did come, how can I word it? It wasn't, we had extra care, but it still wasn't enough. And the care that we did have was, in my opinion, substandard. And I can talk about this now. I couldn't talk about it previously because of legal things, but yeah, the care that we received wasn't the standard that it should have been,
And
which
that's
is
like
part
during
of.
the pregnancy or like during or at the hospital or all of it?
No, well, all of it really, but during the pregnancy mostly, the obstetrics care wasn't what it should have been. And had it have been better, I can't guarantee they would have been here. But if we'd have caught that infection earlier and treated it, the outcome could have been very different.
So it's an infection that could have been potentially treated or
Yeah, so the infection that led to sepsis was chorioamnionitis, and it was a rising infection that, if it's treated early enough, it can be treated with antibiotics and cleared. But if it's left past a certain point, it's almost always fatal.
was your health at risk too?
Yeah,
Yeah, yours.
yeah, unfortunately.
Yeah, I'm mad at your I'm mad at your doctors for you.
Thank you. I know it's
It's
yeah,
I mean, yeah, it seems like you had some really great medical people like the NICU nurse and things like that, but then some that shouldn't be in medical care.
yeah. I mean, I'm always careful what I say because I don't want to get sued. But but there were lots of issues where things weren't done the way they were, even things down to records not being taken. Like for the first probably 6 months, the records from the first 2 days of Eden and Hudson being in the NICU had gone missing. Just things like that, but so many of them piled on top of each other. You look back and you think it's no wonder that this happened. Which again is another gripe that I have, is that medical care for mothers is not what it should be, and it shouldn't. I mean, my my care for the extended part of my journey is that I do have a living child now. I have a little boy called Sonny. He's just turned 2, and he's the light of my life. He's helped me in ways I can't even describe. But the care that I had through his pregnancy was under a different hospital, and it was a world apart. I had the best consultant, and she will always be one of my favourite people in the world. She's the type of person that should be a doctor. She just has so much care and empathy, but I always get so frustrated because it shouldn't take losing a baby to get the pregnancy care that we should have in the first place. And I understand that there's training and staffing and all these issues, but when you are playing with people's health and the lives of babies, you cannot take risks or cut corners, and that's what I see happening a lot, and it's not fair.
Sometimes it feels like they just think, oh, well, it's just one baby. But to you, that's your world. That's not just one baby they lost. That's your baby they lost.
Exactly. I think I see it a lot being in this field as well. I think it's so easy for medical professionals to become so desensitized to it because they see it on a regular basis that they forget that when those parents are going through that experience, their entire world is falling apart, and that is the worst thing they will ever experience in their lives. And it's so easy to get caught up in it being part of a regular occurrence for you and not taking back a step back and taking stock of the fact that this is earth shattering for these people, that lack of care and empathy can often be lost. And I think that's a real shame. And I think there needs to be a lot more work on bereavement care and support and just empathy and compassion in general.
Oh, yeah. No, I agree. It seems like you just kind of, it's luck of the draw. Like, okay, you went to this hospital. You just happened to have great doctors, or you went to this one. Sorry, you ended up with the non-compassionate one, and it's hard to know,
Yeah,
obviously, when you're in an emergency, where where to go. You go to the closest one, right? So
100%. I mean, over here we call it a postcode lottery. So we have postcodes, not zip codes. But yeah, we call it a postcode lottery. It just depends on where you live, will depend on what care you have access to, what resources you have access to. And I don't think that that is fair or okay at all. Everybody deserves equal, compassionate, safe care for them and their child.
So how did you decide after all that you had gone through that you were ready to try again and go through pregnancy again? Because that's a question I hear all the time. And my answer is always, I don't think I was ever ready. I just did it.
I'm laughing as you're asking me that question because my response will be the exact same. I was not prepared in the slightest. I think Lewis would have had another baby straight away, and I think this is something I always say to my clients: is that as men and women, we process things so differently, which is why I work with lost moms and not lost dads, because I can't claim to understand how dads process it, but I know how lost moms process it. But yeah, Lewis was like, right, well, we'll just try again. And I was like, hell no, you are never coming anywhere near me again. I'm not doing this again. And it got to just under a year after they passed. I think it was, I want to say it was like the August after their first, that they were born in June 2021. So this was August 2022. And we'd had multiple conversations about it, and I was like, okay, I'm not ready. But the reason that I agreed to try again is because it took us so long to fall pregnant with the triplets. I thought we were going to be on the same journey again. So I agreed to start trying. I was like, okay, well, I'll just start to track my cycles. We'll figure out what's going on because we might have to go back and get some support again. Lo and behold, that didn't happen, and I fell pregnant in 2 months, which is I'm so grateful for, don't get me wrong, because I know that infertility and secondary infertility is something that we see so often in this community, and I do not for one second take for granted how lucky we are. And I saying that, I always feel like one of those women that's like, oh, I just fall pregnant so easily, and I know that people want to punch me in the face for something like that, but I appreciate how lucky we were. But I remember I actually found out I was pregnant on my 29th birthday, and just I can't even explain the feeling, because it wasn't anything like the first time. It wasn't that complete elation and happiness. It was a spark of joy of seeing a positive test, and then it was a, oh no, we're here again. Okay, how are we going to go through this? How early can I find out if it's multiples again or not? All of these questions. And then just ensued the absolute spiral that is pregnancy after loss. And that pregnancy, I think, was enough to put anybody off pregnancy ever again. Not from the physical sense. I had a healthy pregnancy. I mean, I had gestational diabetes in both my pregnancies, but other than that, I had a great pregnancy. Again, I didn't have morning sickness. Super, super lucky. But just the emotional and mental toll that pregnancy took on me, I don't know how I made it through. And I was already doing this job at that point, so I felt like such an imposter guiding people through their grief, and I hadn't told anybody that I was pregnant at that point, so I felt like such a fraud. Even though I was helping people and I knew I was helping, I just thought, yeah, but you're struggling yourself. So yeah, it was a weird journey. And then I had my son, had the dream birth. I had a scheduled section, but it had righted all of the wrongs of my previous C-section. It was everything that I could have hoped it to be. And I had my son, and I remember thinking, okay, he's here. It's going to get better now. And it did not. I ended up with severe postpartum depression and anxiety, to the point that I couldn't leave my house. And I just thought, I failed. I've got here, and I've got everything that I've ever wanted. Why doesn't it feel like it should? So then I went on my own journey before I returned back to work. I took my maternity leave, and I went to a friend of mine and told him what was going on, and he helped me with the form of hypnotherapy that I use now. And again, that was life changing for me. Just completely, within the space of a couple of weeks, just completely turned things around for me. And yeah, I am where I am now, in a place where I can talk about my grief and cry about it, but cry and move forward and know I'm okay. And I'm enjoying parenting after loss and just letting that hope and grief live together.
I think a lot of people think that, you have that rainbow baby and then like it doesn't replace them, but like you're healed now. Like you're good. You have your living baby, so
You
what's
should
there
be
to be
fine.
sad about?
Yeah.
It's like, oh, but it just like created so much more grief even. Like just
Yeah.
all the, every time they pass a birthday or a milestone, it just reminds you of how old your other baby would be or babies and what they would be doing. And, it's just like it just makes you all too aware even more of like what you are missing out on.
100%. I couldn't say it any better myself. I think it just opens up a whole new can of worms when it comes to grief, and it brings grief and the feelings underneath grief back with such a force, but in such a different way. So for me, it manifested just in severe health anxiety. I was so, excuse me, paranoid that my son was going to get sick and he was going to die, that just consumed everything. The intrusive thoughts were just another level. I remember sitting there when he was about 6 weeks old and just thinking, what is wrong with me? I have everything I've ever wanted, and yet I've never been more miserable. And I think it's that preconception that, like you say, you think, well, I have a baby now. I should be grateful that I have a living baby, and why can't I be happy? And you forget that you need to give yourself grace for what you've been through and the journey that you've had to take to get here. And I always say this to all of my clients, this is the only form of pain and PTSD that anybody would ever expect somebody to keep re exposing themselves to in order to try and get a different outcome. And I don't think we give ourselves enough credit for that, that going through pregnancy after loss and birth and parenting after loss is reliving that trauma on a daily basis. And like you say, every milestone that your living child passes is just a brutal reminder of the milestone that your baby or babies that died won't ever pass. And that's really difficult to carry for anybody that would go through this.
Sometimes I would tell myself, "Are you crazy for doing doing this again? Why are you doing this?" But yeah, I mean, it's just, like you said, that we just do it again, hoping for that better outcome and, just trying to let the hope be stronger than the fear and the sadness. And even though, we never get rid of those, we just learn to coexist with all of them together at the same time as they all just decide to come at you from every direction.
100%. I think I will say to everybody, and I think a lot of people, especially if you're freshly going through your grief, you'll look at me and think I'm absolutely crazy when I say this because you think, how could anything be any worse than losing your baby? But pregnancy and parenting after loss is the hardest thing I've ever done. And I say that in the sense that not to take away what I went through with my babies, but the fact that having to carry that and then go through something on top of that is the hardest thing. And it's taken me 2 years to get to this point where I'm sitting in a space where I can allow the grief and joy to coexist, parenting after loss. But I'm 4 years out from my loss as well. And I've always said, and I think Hayley from Hey Loss Mum always words this really well, because it's not that time doesn't heal, but time gives you the space and the capacity to process what you've been through and gives you the capacity to find ways to cope and to move forward. And I always say move forward, never move on, because how can you move on from something like that? But you move forward, you carry it with you, and you learn ways to cope. You learn ways to parent your babies that aren't here and learn to parent your babies that are here. You learn how to build their bond and relationship. You learn how to find yourself again and all of these things. And unfortunately, that does take time, and I hate that I have to say that. But it does. It's taken me time to get here, and I'm really proud of myself for getting here, and I'm really proud of the fact that I get to support people through this, because it's such a sacred thing to have to go through and such a sacred process. But I do genuinely think going through this process with somebody that understands it makes it so much easier. And I think that's why we have such a strong community as well, because just that shared sense of solidarity and understanding goes so far.
Well, if people are interested in working with you or finding out more about you, where would they go for that?
Yeah, they can reach out to me on Instagram. I do everything through there. That's always been my home. So it's at Elle Hypnotherapy. And I share everything there. I share what I do, tips and tricks, my own life, my own grief, some dark humour sprinkled in there,
Gotta
as
have
we
dark
love to
humor.
do. But if anybody is struggling and they need some help and they don't want to go through it alone, they don't have to go through it alone. You can drop me a DM, and my door is always open for anybody that's going through this. I would never want anybody to feel like they're in it alone.
Well, I want to thank you so much for coming on and sharing your story with us today.
Thank you. It's honestly been a pleasure, even though I've cried at you for an hour. Thank you for giving me a platform to share my story and to share Noah, Eden, and Hudson, because they are such a big part of my life and such a big part of my journey, and they're the sole reason as to why I'm here. And I always say I would rather give all this up and live in a cardboard box and have them here, but I can't, and this is the next best thing, and I'm so grateful to them for putting me on this path to be able to help people.
Thank you so much, Elle, for sharing your story with us. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a positive review or rating on Apple or Spotify. It only takes a moment and really helps the show reach more loss and infertility families. Thank you so much for tuning in, and remember, we are all in this together.